Hi, class. Welcome. It's Dr. Linder. What we're going to be looking at in this next several videos, we're going to be talking about the spinal cord, but now more instead of the anatomy of cross section of the spinal cord, we'll spend a little bit more time talking about the nerves as they come off the spinal cord and get into some of the main structures that they innervate. So one of the things that you want to be familiar with is the nerves, the number of nerves. So when we look at the number of actually pairs of spinal nerves, all the way from the cervical spine down to the uh, coccygeal, there are 31 pairs of spinal nerves, and they're named and numbered by the cord level of their origin. Now, you remember that we have C1 through C7 vertebrae, right? We have C1 through C7 cervical vertebrae, but in terms of nerve roots, there's 8 pairs of cervical nerves, C1 through C8. So I don't want you to get confused saying, well, I thought there were 7 cervical vertebrae, and there are, but there's actually 8 pairs of cervical nerve roots. And that's because the very first one comes out between the skull, right, your occiput and the C1 vertebrae. Between that, that's where the C1 nerve comes out. Okay. So there are 8 pairs of cervical nerves. Then there are 12 pairs of thoracic nerves. There's 5 pairs of lumbar nerves, 5 pairs of sacral nerves, and then there's 1 pair of coccygeal. So when you add this up, right, 8 and 12 is 20, plus 10 is 30, plus 1 is 31 pairs of cervical nerves. Now, as these nerves come out, the nerves are considered to be mixed. Mixed meaning there are 2 different parts to it. There's a sensory part, and then there's a motor part. So whenever you have sensory and motor nerves, we consider that to be a mixed nerve. Now, much like myology, when we covered myology, you remember we did an endomysium, a perimysium, and an epimysium. It's the exact same concept, except we're going to take the word mysium out for muscle and put the word neurium. So endoneurium, perineurium, and an epineurium. When we did myology, right, we had the little muscle cells, and it was an endomysium, a perimysium, and then an epimysium. So now when we're talking about, we just take the word muscle cells out, or those fibers, and we put the word axon on it. So the layer that surrounds each axon is going to be an endoneurium. And then you have a bunch of those axons that are clustered around by a perineurium, which also is considered a fascicle. Then you have a bunch of those fascicles surrounded by an epineurium, and that's what's going to surround the entire nerve. All right, now when we look at the spinal cord in the center, we can see the spinal nerves coming out on each side. We could see the vertebrae protecting it, and we can even see some musculature on the posterior side, right? Here's posterior, here's anterior. We know that because you've got the vertebral body, which is always anterior, and then you have the spinous process, which is posterior. Now, why is that important? That's important because it helps you differentiate in terms of the actual spinal nerve, it can help you differentiate the ventral root from a dorsal root or a ventral rami from a dorsal rami. Okay, so right back here, we see that there's a dorsal root. And then right here is the ventral root. So you have a ventral root and a dorsal root. And when they come together, what we have is it's going to make up a spinal nerve. And the spinal nerve is mixed because they're sensory and motor. Okay. When we look at the nerve and we follow this yellow nerve root out, the thicker one right here, this is called a ventral rami. And then branching off to the posterior is a dorsal rami. So you've got an anterior and a posterior rami. The ventral rami, this one right here, is very important because the ventral rami, those thicker nerves that we see right here, that's really important because that's what's going to form the plexi. So your cervical plexus, your brachial plexus, your lumbar and sacral plexus all they stem from the ventral rami. This dorsal rami back here, that's going to supply the skin and the muscles of the back. Whereas the ventral rami, they're going to supply the anterior trunk and all the limbs and all the muscles of the upper and lower extremity. Now we have a meningeal branch right here. This little tiny branch right there, that's going to supply the meninges, the pia mater, the arachnoid, the dura mater. It's going to bring blood supply to the bone, to the vertebrae, and it's going to bring innervation to the blood vessels themselves. So the meningeal branch innervates the meninges, the vertebra, and the BV is for blood vessels. All right, let's take a look at what a nerve plexus is. And when you look at this picture, it really looks like an intertwining, right? Like if you took someone that had long hair and you wanted to braid it, that's what a plexus looks like. And a plexus is the joining of the ventral rami. And they are found in the neck, they're found in the arm, they're found in the lower back, and in the sacral region. The only place we don't have a plexi, the only place we don't have one is in the thoracic region. So in the cervical region, we have two plexi. And in the lower back region, whether it's lumbar or sacral, we have two plexi. But where we don't have one is in the thoracic region. What we have in the thoracic region are intercostal nerves, which means nerves that are going to go between the ribs, going to the intercostal muscles. So what we're seeing in this picture is the cervical region in the neck. And we can see that in the cervical region, we have two different plexi. There's a cervical plexus, which goes from C1 to C5. And then there's a brachial plexus that shares, you can see it shares that nerve root of C5, and it goes down to T1. And there are going to be important terminal branches that come off of the cervical and brachial plexus that are important to know. But what you'll see for the most part is that the cervical plexus, the nerves typically go up somewhere to the head and to the scalp, with the exception of the supraclavicular, and the phrenic nerve. The phrenic one is kind of important. That one's going to go, there's a little saying, and it's C3, C4, and C5. Keep your diaphragm alive. C3, 4, and 5, keep your diaphragm alive. So this phrenic nerve ends up going to your diaphragm. So cervical plexus, for the most part, goes up, whereas if you look at this brachial plexus, it goes down, like to the shoulder and down the arm, down into the fingers. All right, so we'll take a break here, and then when we come back, we'll get into the cervical plexus.